I think, when we talk about immunotherapies, we're talking about antibody-based strategies as well as T-cell therapy directing strategies. So within antibody-based strategies, we're all familiar with the naked antibodies that target anti-CD38, or rather CD38 and SLAMF7. We've seen, the clinical activity as monotherapy of daratumumab and isatuximab. And data has made its way to the frontline setting, and those data sets are quite mature. But now we're seeing more data with the antibody-drug conjugates. Over the past 2 years, we've seen, Belantamab Mafodotin, which is the first BCMA-directed antibody-drug conjugate, getting FDA approval based on the DREAM2 study. And now we have combination data with different scheduling and doses being developed. And that's really being done to mitigate some of the ocular side effects we were seeing with that strategy. And it's encouraging to see that even with lower doses and combining with proteasome inhibition and immunomodulatory drugs, those combinations retain the efficacy. And especially with the Pomalidomide combination in the ALGONQUIN study, we're seeing better tolerability for patients. So I think there's progress being made in understanding how to dose and schedule that antibody-drug conjugate better. Then talking about T-cell directing strategies, we have the bispecific antibodies in that space. Most commonly, we've targeted BCMA. There are several constructs that are in the clinic. Teclistamab is probably the farthest ahead in terms of its clinical development, but all of them are showing clinical activity between 60 to 80, 85% in terms of overall response rates, but lower CRS and neurotoxicity percentage and grading compared to the CAR T-cell therapies. And that's the T-cell directed strategy that has shown the most efficacy, whether it's ide-cel or cilta-cel. And now both those CAR-Ts are moving into the earlier line setting and even being evaluated for high-risk patients in the front line setting. So I think the future belongs to immunotherapies. We've come from naked antibodies going towards the antibody-drug conjugate combinations, and there'll be room for each of these strategies. Bispecifics and CAR-Ts are probably the more promising T-cell directing therapies. And in one of the talks earlier today, from my colleague Vincent Rajkumar, he showed a figure where we have 7 or 8 other surface marker targets that are being explored, in preclinical as well as clinical space. So I'm very hopeful that all these immunotherapies eventually lead to curability for majority of myeloma patients.